community when needs be. So I'm hoping that everybody is holding on strong. Again, this morning we have a wonderful topic for all our listeners. It's not a very common topic, but I'm sure it will be quite interesting, and I'm hoping that take some time to listen in. All right. This topic this morning, our topic is childhood cancer, and childhood cancer is not a very common thing that you normally hear, and that is why we chose this topic, and that is why we really, really want persons to listen in, take time, because you never know, and so on. Because sometimes our children go through so many things and we're not aware of what they're going through, and we keep on, wondering what is wrong with them. And although it's not something we hear very often, but February 15th, that's the month for childhood cancer, and that's the date for childhood cancer awareness. And the topic was raising awareness of pediatric cancer. All right. None of us want our child to have cancer. None of us want our children to face that battle. So, um, this morning we have our guest speaker, and I'm sure many of you might know her. Some of you might not know her. I personally have not met her myself, but it's always a pleasure, and I can tell you it's always a pleasure to have our guests, doctors on board with us, because they play such an important role in providing the information that we need to improve our everyday lives. All right, Doc. Good morning, Doctor.
Good morning. Good morning. Thank you for having me.
It's
I'm
always
happy
a
to be here
pleasure.
and to be able to help you shed some light on childhood cancer today.
Wonderful. So, Doc, I would allow you to introduce yourself to the public.
Okay, my name is Delphina Bona. I am a district medical officer currently attached with the Ministry of Health. I work at the mainly at the Grizzly Polyclinic, some of our community health centers also. Prior to this, I worked as an emergency room physician at Victoria Hospital when it was the regular hospital, and also at the Tapia Hospital emergency room. So yes, and now I'm glad to be in community service.
Wonderful. I'm sure you, I'm sure the experience in community service is a little different from the hospital setting, especially meeting your everyday community people. I'm
Yes,
sure it's
definitely.
very, very interesting. I can speak to that because working in community, you meet so many different um people, different family members, people. I mean, I don't even know how to describe it. Every day is actually a new experience out in the community, and it's always good to
Definitely.
be out there helping community members. And
Yes, I would
you know,
agree.
yeah, one of the things you drop on family members that you never knew of. Always. So, Doc, um, let us start. Um, let us start by just briefly explaining what is cancer. I know many people, I mean, they have adult cancer, children cancer, but just give us a little brief about what exactly is cancer.
Okay, so I think cancer is something that we have been hearing a lot about. In the past few years, it has become so common. Some patients come and they refer to it as the big C or the C word. Some people are even a little scared to actually say the word, because usually once you hear cancer, it's not something good. It's not a diagnosis you ever want to receive. So a lot of people become very scared or intimidated when they hear the word cancer. In very simple terms, cancer is something that happens in our body when the cells no longer go through their normal dividing, normal replicating, you have cells that are now dividing at a rapid rate, and they're dividing abnormally. So this may happen for multiple reasons, but sometimes it's a what we call a mutation. You may have heard the word mutation as it relates to the viruses. Change, basically, it's a change. So it's a change that happens in the structure of the cells, which is the very smallest unit of our body, and also in the genetic material. And that change is not a good thing. So it causes the proliferation or the rapid dividing of cells that are not good, putting it simply, and then that causes a cancer. There are many different types of cancers, and when you look at individual types of cancers, then you're able to better explain what happens in each type. As you mentioned, in adults and children, we are all susceptible to getting cancer. It does happen in children, not as commonly as it does in adults, but definitely still something we see. And it's good that we are actually talking about it so that parents, friends, relatives can be aware of some of the things that they need to look out for. And if you should have any suspicion that your child may have a cancer and then you want to take them to the doctor for further investigation.
So, Doc, what are some of the signs of symptoms? Well, what are the different types of cancers you actually see in children?
Okay, so according to the World Health Organization, and that data actually meshes with what we see in St. Lucia, the most common cancers that you see in children are the leukemias, brain cancers, lymphomas, and some solid tumors that occur in different parts of the bodies. Um, the leukemias, I would say, are definitely the most common ones that you would see in children. And that's in keeping with what we see in St. Lucia, according to the statistic that we have for the occurrence of childhood cancer. Now, you may ask, what are the leukemias? Essentially, the leukemias are cancers of the blood. They happen at the units of the bone marrow and the blood, which makes all the blood cells that we have. So there are different types of blood cells in the body. We have our red blood cells, we have our white blood cells, which usually help us fight infection. We have platelets, which help our blood clots. If you get a small cut and it doesn't continue to bleed, so the platelets help with that. The red blood cells, the hemoglobin, that's what gives you your blood count. So most times when people talk about anemia, they talk about a low red blood cell count. So the leukemias occur at that level, and it's a blood cancer. So it's something that you would see that happens throughout the body. Um, the brain and spinal cord tumors, again, more often would happen in the brain itself versus the spinal cord, which is the extension of the brain that goes through our backbone. Um, and also, we have some solid tumors. Some of the solid tumors, we have things like neuroblastomas, which usually are a growth in the abdomen. We have the Wilms tumor, which is sometimes called a nephroblastoma, and that tumor occurs in the kidneys. We also have lymphomas. So lymphomas, not to be confused with leukemias, the lymphomas usually occur in the lymphocytes, and a lot of time they occur in the lymph nodes. So these are some of the more common ones that we see. We also have tumors or cancers that can happen in the eyes, called retinoblastomas. And we have cancers in the muscle, in the bone, rhabdomyosarcomas. We have different bone cancers. So essentially, you can have a cancer anywhere in the body. And the entire body is made up of cells. All the cells can be affected. But the most common ones that we see in children would definitely have to be the leukemias, and then the spinal cord and brain tumors, and a few of the solid tumors, like those we see in the abdomen and stuff. If you started asking about the signs and symptoms. For a lot of them, the signs and symptoms will be very vague in the beginning. It may seem just like a sign of any illness, and as we know, children are prone to illness. I think now, as we speak, a lot of parents are probably going through this for the past couple years with COVID. our children were quite sheltered, right? We were either
Yeah.
indoors, we were not going out, not socializing as much. School was closed for a long time. We were wearing our masks. So all of those things created barriers to infection. So right now we are definitely seeing more little kids with, just coming with the stomach bugs, and we're in flu season. So we're seeing the flus and the colds. And of course, we still have COVID, but, we're seeing a lot of other little infections popping up. And some parents are asking, but she was just sick 2 weeks ago. I mean, even personally, I've experienced it with my own children. And it's just that our children's immune system was kind of, we had them in a little balloon for a little while. So now they're getting exposed, and their immune system is doing what it normally does, which is develop immunity, develop resistance against, the common bugs that we see. So the signs and symptoms initially of any cancer may start like what looks like a regular infection. Your child may say they feel a bit tired, their their appetite may change. They may have fever, they may have pain, they may have poor appetite, vomiting, diarrhea. These are all just things you would suspect. They have a little flu, they have a cold, they have a stomach bug, something like that. However, if you realize that you have now treated that, you took your child to the doctor, they were treated for the possible viral infection or even a bacterial infection. They got the antibiotics, boost on their vitamins and all of that. But these symptoms are either recurring or not resolving at all. Then that's when you have to be a little more, there's something else going on. So obviously you go back to the doctor. You don't say, the doctor don't know what they're talking about. My child is still sick. You return so that we can investigate further. Because of course, because childhood cancers are not common, it's not going to be the first thought when you see a child, unless that child is already having significant symptoms that points to that diagnosis. So when the child presents to you, that will not be your very first thought. So for the leukemias, just to be a little more specific, the children may have bone pain or joint pain. They will have the fatigue, the weakness. You may notice that their skin is pale. Their face, their tongue, where it normally looks moist and red, looks kind of lighter in color. You may find that they bleed easy. So if they have a little bump, they may develop a bruise on the skin. Or if they get a little cut, as normally happens with a child who's running around and playing, you may find that that bleeds a little more than normal. They may have fever, and especially fever that comes in the night. So sometimes we call it like nighttime fevers or night sweats. Usually, when you have a fever and it starts to break, you develop a sweat, right? So if you notice that's happening a lot in the night, weight loss is also a significant symptom. So you find that your child is eating, or they may have a decreased appetite, and then they're losing weight. So that's a warning sign. Normally children are good eaters and they tend to gain weight as they grow. So if you notice your child is losing weight, that's significant, then that is a cause for concern. For the brain tumors, usually we find the more common of the brain tumors, they affect the back of the brain. And that is where things like your balance center. So you may find that your children appear to be a bit off balance. They may complain of feeling dizzy. They may want to lie down a lot because when they stand up, they feel like they're going to fall. They may develop seizures, which is not something that they've experienced before. They may have trouble walking, trouble picking up objects, things to do with coordination. Maybe they seem a little off. So if they try to pick up something and it drops out of their hand, these are some of the things that you would see if you have a brain or spinal cord tumor. For some of the other tumors that are more specific, for example, I mentioned the Wilms tumor, which is a tumor in the kidney. Your child may complain of belly pain, right? So they may have a belly pain that's just not going away. Now, even if you're not a doctor, if your child mentions, they have a persistent belly pain and you notice it doesn't have any association with, when they eat or if they want to use the bathroom or something, you can have a look, because a lot of times these tumors start to grow and you can actually see the difference in the abdomen. You may see a mass start to develop or a mass start to produce, especially if you have a slimmer child. It may be obvious. So then you would be like, something is not right. Let me take my child to the doctor. For some of the other ones, for example, the bone, a child may complain of persistent pain in a particular area, and they would not have had any trauma there. So they didn't fall while playing football or anything like that, and they have a lump on their leg that's painful and not going away. So then you want to take them in to look at that. For the lymphomas, we mentioned a lot of time they may have little glands, so glands in the neck, in the armpits. These may be persistently swollen and not resolving, even though maybe the initial symptoms of, when sometimes when you have an infection, your glands get a little swollen, a little tender, but then that goes away as you get better. So if it's something that's not improving, then again, you'd want to have a look at that.
Thank you, doctor. Just listening to you, I mean, as a mother, just listening to you say, oh my God. I mean, sometimes our children come and they complain. That doesn't mean everything doctor said there that obviously your child has signs and symptoms of cancer. But these are everyday things you hear children complain about, some of them. And and that is the last thing on your mind, because I mean, you had a child say, "Mommy, my belly hurting me, mommy this, mommy that," and to you it's a normal thing, and maybe one child or a few children. So I mean, in future, when my daughter say, "Mommy, my belly is in," me," I say, "Child."
But remember, we said this, if it persists, because we
Yeah,
expect those things. Every child is going to have a bellyache once in a while. They ate something that didn't agree with them. They ate late. They didn't eat their lunch at school. And then they come home in the evening and you try to give them dinner and their belly is hurting. So it's not the first, you don't jump to that. And because even as a physician, it's not the first thing that we're going to jump to, right? This is not, it's very rare. Childhood cancers are rare. So that's definitely not our first thought, but it's not something you want to ignore if
yeah.
it persists.
I know, Doc Bears. I know me listening, and that's how I'm feeling right now. Father says somebody else that is listening, so that is why I'm saying,
Yes.
these are very common things in children, like you said. But if it's persistent, that's something you shouldn't ignore. So, Doc, can you tell us at least some of the risk factors or the cancers of childhood cancers? I mean, what really triggers some of these childhood cancers?
Okay. So the interesting thing, and this is one of the significant differences
Mhm.
between cancers in adults and cancers in children. The vast majority of the cancers in children have no known cause. We do not know what triggers it, what makes that DNA change or mutate to give that particular child a cancer. With adults, there are a lot of lifestyle related risk factors. But as we always say, these things take time to develop. So when you have a cancer developing in a child between, from anywhere from birth or 1 year old to 18, which is where we usually consider, children, they have not been exposed to any risk factor for any significant amount of time for it to actually trigger a cancer developing. So for a lot of childhood cancers, there is no known cause. There is a very few subsection of the cancers that have a genetic predisposition. So maybe if somebody in your family had that, you may go through some gene testing or some genetic screening. But these are in a very few cases. The majority of cancers in children, unlike that in adults, is not preventable, and it's not because of any lifestyle or any risk factor that the children may be exposed to. And that is something that is important to see, because when a child gets a diagnosis of cancer, a lot of times you find parents going through a lot of emotions, and some of these emotions, are guilt and blaming themselves and saying, what could I have done to prevent this, or what did I do to cause this? Why my child? Could I have did I not see the signs? What could I have done differently? And it's very important for parents to understand that, they are not at fault. It's not something that you did or didn't do. That being said, there are some things, for example, we know that for adults, smoking, obesity, your diet, chronic conditions, diabetes, alcohol consumption. We know these things present risk for developing chronic disease and for developing cancer. So we always mention, especially for our pregnant women, these are not things that you want to be exposing your child to in utero. So in as much as there hasn't been much evidence to say, but we know it can affect us as adults. So obviously, you want to avoid these exposures for your children as well, right? And we know even if it's not for cancer, but these things do affect the brain development and other things with our children, right? So we want to make sure that we try to avoid those things, but there aren't specific risk factors for children. Some of the other things that we can do to help our children, I should mention, for example, is like vaccination, right? So in recent or a few years back, St. Lucia introduced the HPV vaccine. We changed our vaccination schedule so that hepatitis B vaccine is now given at birth, which was not being done, I mean, when I was a baby.
Yeah.
um, so these are some of the things that we do to help our children, because hepatitis is a risk factor for the development of liver cancer. The HPV virus is linked to cervical cancer in our girls and our young women, and we're seeing that much more frequently and in much younger women. So that's why the HPV vaccine was created and is now part of the national vaccination schedule. So these are some of the things that we can do to help our children. But in terms of the actual risk factors, there aren't any really that's for children. It's more so as it relates to adult cancers.
Thank you, Doc. So, Doc, I mean, sometimes we as parents, I mean, we see different signs and symptoms in our children, and continuously we take our children to seek medical attention, and sometimes we feel that, oh my God, I've been taking the child to the doctor for so long for these things. So, how does a doctor know if a child has cancer? What
Okay,
from them to know that a child is actually, they see the signs, but it can be so many things.
right.
So how do they know?
Okay, so as I mentioned earlier, when you have a child with signs and symptoms and you take them to the doctor, the first time we see that child, cancer is not going to be on our mind, right? We will first want to treat the child for, maybe a little infection. We'll say, maybe some the bug that's going around that they have. So we give the normal treatment that we would for that. Perhaps we will send for investigations, depending on how sick the child presents. But if the child does not present extremely ill, we may just try to treat, right? That is absolutely normal. However, if the child has not improved and the symptoms continue and you bring the child back, then would be like, okay, well, maybe something else is going on. Let's do some investigations. So usually we start with the simple things. We may order some blood tests to look at if the child is showing any sign of infection, if there is any change in the results, is anything higher than it should be, lower than it should be, what is abnormal. So that would be a starting point, right? Based on that and based on what the child complains of. For example, if we have a child who complains of the belly pain, and when we examine the belly, we think we feel a mass or something that feels bigger than it should be, we may order an ultrasound, which is the simplest imaging that you can do to look inside the belly and see what is going on, because we will not be able to tell by just the examination, right? So we may order an x-ray. So say that the lump is on the leg in the case of a bone cancer, right? So we may order initially an x-ray or an ultrasound. And of course, if the symptoms are more significant and they point to something in the brain, for example, if it's the vomiting, the seizures, the lack of coordination, then we would need to do something like a CT scan of the brain. And this would be in an effort for us to try to pick up what else may be going on, because obviously it's not what we initially thought. So it's a process, a stepwise process, because the cancer will not be the first thing that we think of. So, and that's something that I want us to understand, because sometimes we're quick to say, well, I went to the doctor and the doctor just said it's that, and they didn't do anything. But I'm trying to explain why this is how we go through it in a stepwise manner, because it's not the first thing that we're thinking. So we go through. When you do those initial investigations and you return with your blood test, your ultrasound, or whatever else that was done, then we may have some more information that may point to the diagnosis of cancer. So if we see an abnormal mass in the belly on the ultrasound, then we'll say, okay, there is definitely something there that we need to look into. And then you will have further investigations, and then you can be referred to the specialty that would deal with that. Um, if we notice something off in the blood test, and this is at the clinic level, we may send you to see the pediatrician, so that they can look into it further, and that we can now try to think about treatment options, right, for the cancer, based on what it is that we think the diagnosis may be.
Doc, let me just say that many of our, community members, including myself, sometimes we go to the doctor, we seek medical advice, and since we see our children not getting better, a lot of us revert to bush medication, bush doctors, da 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 da. What advice do you have to give to those persons that tend to kind of, I don't know if they I don't know if it's advice from other community members, because I come from a community where this is tradition for us. This is part of our culture, and sometimes you see the harm, the good, the bad in it. So, what advice do you have for persons? Maybe they taking their children to seek medical attention, and then they're not seeing the improvement. What advice you have for these persons that tend to kind of stray away from, seeking medical attention to help improve the situation a bit?
Yes, I have to say that this is one of those things that really hurts me. And it hurts me because I see the effects it has on the patients. And sometimes you think things that could have been avoided, you see lives that could have been saved, and it's extremely hurtful. And that's why I've been reiterating that childhood cancer is rare. So if you first go to the doctor and this is what they tell you, it's because cancer is not the first thing on our mind, right? Now, for others, you may want a second opinion. I'm sure there's another physician that you can go to get a second opinion, and that's fine, because sometimes you may not agree with what the first doctor said. You may have another concerns. You didn't like the way they spoke to you. That's okay. Those things can happen. We're humans. We all have our personalities. Different things can happen. As much as we're supposed to, be professional in what we're doing. Um, I always tell people I don't have an issue with bush medicine per se. I'm sure all of us grow up drinking some bush tea at some point for a bellyache or a cold, when your grandmother give you some bush tea to drink and you swear you feel better, right? We also have medications that originate from plants, and all of those things. So there is a place for it. But it's just that with bush medicine, a lot of the things are, where is the dosaging? How do we look at the effects? There are so many things to consider. And I always ask, well, what investigations were done when you were told you have X or Y or Z? There is nothing to substantiate it, right? That's how I feel. And then you have the patients who now return to you when they are in an advanced stage of the disease, because all of this time where you could have intervened has passed. So I always try to tell patients, there's nothing wrong with going to get a second opinion. You can see another doctor, you can speak to your nurse, speak to your somebody in your community. But I really think, to a certain extent, some of those who revert to the alternatives end up harming themselves much more than helping themselves. So it's not something that I can encourage at all.
I agree with you, Doc. I too. I too, I see it happening every day. That is why I ask the question. Because a lot of people tend to feel that they lose confidence in our doctors based on other people's experiences, and not everybody experience is the same with that particular doctor.
Very
And like
true.
you said, we all are human. And I mean, my experience with one doctor might not be the same the other person's experience with that same doctor. So we have to be mindful of all these things. And like you said, we can always get a second opinion. And a lot of people, I mean, they tend not to, and just feel that the first opinion, and then take matters into their own hands, and always makes matters worse. And we see it every day at the clinics. So that is why I ask that question, because I do not want our persons, that tradition, that culture, to continue, because they're doing more harm than good
Yeah.
sometimes.
And I mean, when you think about it, we are a very small society. We do not have a lot of specialist care. We don't have, specialist centers and things like cancer. They need what we call a multidisciplinary approach, where you have persons from different disciplines working together to try and help the patient and to help that patient recover. So even in St. Lucia, because we are such a small medical fraternity, we have a lot of collaboration. So I'm sure, if as a junior physician or as a physician working in the community, if we see something that we are suspicious of, or we think something is going on, I can pick up my phone and I can call another doctor, or I can call the pediatrician and say, hey doc, I saw this patient, I'm seeing this patient with XYZ, and I'm a little concerned. I'm going to send them to see you. And try to explain to them what I found, what investigations I've already done. You write a referral, but you call, we can do that, because it's not like I don't know who the doctors are. So we try to do that. And even amongst themselves, I'm sure the pediatricians and the surgeons and the oncologists can come together to discuss a case, so that we do what's in the best interest of the patient at the end of the day.
Thank you, Doc. That really, really gives us some reassurance that, good things can happen, and with good collaborative efforts among our doctors. Doctor, is there anything you would like to add? Anything as it relates to cancer in particular, to our public out there? I know we see many different types of cancers. I mean, I mean, they are diagnosed. Some people see the signs. They don't want to seek medical treatment. They don't want to come to our wellness centers. They don't want to go even to the private doctors. What advice do you have to our public out there, and what have you been seeing out there that can, provide some light to our public out there, for those persons that are actually seeing different signs and symptoms of cancer, and they don't want to seek medical attention?
Okay. So, we said earlier that our childhood cancers are rare and not something that we can usually prevent. So, that's just something that we look out for. If by chance, your child has some unresolved symptoms, for further investigation. However, it's quite the opposite in adults, right? So there are a lot of risk factors, a lot of lifestyle related risk factors, and there are a lot more things that we see more frequently. As a matter of fact, in St. Lucia, um, cancer has made its way, up there in the top three causes of death overall in St. Lucia. And that includes breast cancer, colon cancer, prostate cancer, cervical cancer. And a lot of these, to some extent, can be prevented. And if not prevented, they can be caught early, because we have screening for these. Unlike for childhood cancers, there's no screening. You don't do routine screening, because it's something that just happens sporadically in children. But for us adults, we do have screening that has been recommended. So this is one of the things that we should do. We should do the necessary screening tests to check, and don't take it for granted. Well, I had a screening, I was fine, or I don't think I'm at risk, I don't need it. It doesn't hurt you or harm you to do the screening. It's better if you know early and you can intervene early. The intervention will be much less than if it's at a later stage, where you start to have spread from the original site of the cancer to other parts of the body. It's going to be much more difficult. So in addition to the lifestyle things, like managing our health, our diet, exercise, trying to avoid the development of chronic diseases like diabetes and high blood pressure, smoking, excess alcohol use. We've spoken about things, for example, the foods that we eat. So we know things like, for example, cured meats, deli meats. These have been associated with, there is a link that has been established between those and the development of cancers. So, in as much as we can do things to avoid these exposures, right? Right now, we have, as mentioned earlier, the HPV vaccine, and giving that to our young children to prevent exposure to the virus that causes cervical cancer. And also now, when our girls are old enough, to get the pap smear and to get the regular pap smear. I mean, the pap smear is done in the health centers. Um, it takes a few minutes and you get your results. If you have good results, now before years and years ago, it used to be every year you had to do a pap smear. Now the screening time has been increased. If you have a two consecutive normal ones, you can go every 3 years, every 5 years. You know, your doctor will look at your wrist and everything and they will let you know. But it's no longer having to do it every year. I mean, 3 years, that's really have no excuse for missing a one appointment every 3 years, right? To get a pap smear done. We speak about self breast exams, and I always tell patients it's good if you do your self breast exams because when you come in, if you notice something off, you can actually tell the doctor, I feel something different here. Because younger women tend to have what we call they may have glandular tissue, so you may find that the breast tissue may have what feels like a lump or a palpable mass, but it's normal for them. And they will be able to tell you at different points in the cycle, you know, hair is a little bigger, a little lumpier. But if something is different, they may be able to pick it up much better than you, who is examining them for the first time, right? So who has never seen them. So there is a place for the self-breast exam. And of course, we have our mammograms once you get to that age, depending on what your risk is. So if you have a family member who has had breast cancer, you start earlier at about 40. If not, then about 50. The prostate for men, there is simple blood tests that can be done to check. You know, and unfortunately for our population, when I say our population, Black persons tend to be more susceptible. So doing the PSA test once annually to see what your levels are, then if you need to further investigation. So some of the tests are relatively simple, some of them are relatively inexpensive, and something that can be done to actually prevent. And we always hear prevention is better than cure, right? When you actually develop the cancer, it becomes a whole lot more. Now you have to go through different treatment. You need to talk about chemotherapy, radiation. You may need to travel because those things are not always available in St. Lucia based on what the cancer is, where it is, etc. Right? So you may need to go away. That requires a lot more money, right? So the what you can do to prevent will go a long way than if you actually have to deal with the diagnosis. Now, there may be a few persons who still do their necessary screenings and they come up, but then it means you might have caught it earlier. So then what you need to do may be less. So I think it's for us to be aware of what we can do to prevent our lifestyle interventions and the necessary screenings. So I would just like to advocate and to let persons know. And if there's anything you have doubt about, you can go to your health center. If you have a private doctor, speak to them. We're always ready and available to give you that information. If you have questions, concerns, worries, a lot of people tend to go to Google first. There is a plethora of information on Google. There's no doubt about that. We all use Google, right? But it's being able to pick out what applies to you and what you need to use. And remember, anybody can put information on the internet. It doesn't have to be factual. It could be anybody can go and just put something. So you have to know where to look. Is this a credible source of information? You know, so it's best not to just go Googling and then you see all these things coming up and you now fall, right? You don't know what to listen to. So ask somebody who can give you information that you can rely on.
I'm so happy you said about the Google aspect. I think all of us does it. All of us. I mean, that's the first thing we do. We end up googling whatever we feel, and then afterwards, I mean, at that time, your mind is not free because you've seen
Yeah,
so many things that you could be diagnosed with. And then you tend to be afraid now,
for
to
sure.
seek medical attention. And or even if when the doctor tells you have something, you end up going and Google it, and you Googling so many things that you already go off track of what the
Yes.
doctor
And
actually
for
told you
some
that was
reason,
wrong.
we always go to the worst case scenario. That's what we're always looking for. The worst case scenario, which may not apply to you.
So, Doc, in saying that, one of the things I know we're speaking about childhood cancers, but one of the things I quite observe in our everyday clinics is medication compliance. A lot of people, when they seek medical attention, they tend not to take the medication, but still end up being sick, and then they keep on saying, "Oh, my way doctor, et puis m'a fait bien." Yes, but then when you ask them, did you take your medication? How did the doctor tell you to take the medication, or the pharmacist? Or if you were getting sick, did you go back to the doctor, or did you explain to the pharmacist? Because we have easygoing doctors in our
Yeah.
region, as well as our easygoing pharmacists, Alvin. So, I mean, you ask, did you? And they say no. So, what advice you have for people seeking medical attention but still not taking the medication? So, how would they get better?
Sometimes I actually ask them. So the patient will come to you, they will explain their symptoms, you examine, etc., and you tell them what you think is going on. And then I ask them at the end, I said, what do you want from me? I ask them because some of them will tell you even before they tell you what's going on. I just need a sick leave because I cannot go to work, or something like that. And I ask them, what do you hope to achieve at the end of this? But because, as you rightfully said, you may explain everything, you may give them the medication, explain why they need to take it and all that, and then they will leave the office and then they never buy it, they never take it. So I always ask, what do you hope to achieve? This is what I think you have, this is what I think you should do. And that applies a lot in our hypertensive and diabetic patients. Some of them are very reluctant to accept the diagnosis, and I understand that. So, especially if it's somebody that I'm seeing for the first time and this is a new diagnosis, I try my best to give them some counseling even during that brief encounter. And then also to make the necessary referrals or advise them. Maybe I think you should see the dietitian who's going to help you to make better choices for your regular meals. I think do you think you need to speak to the counselor to help you see how you can navigate this new diagnosis? Because a lot of times, if you do not accept the diagnosis, you will not take the medication. Because if you don't think you have high blood pressure, you're not going to take the medication. So, adherence and compliance is a major, major factor um, for how our patients do. And it's something we deal with every day. And I always encourage business. And sometimes I tell them, I say, I know you're not going to take the medication. And that's okay. But here's what I want you to do. At least try to monitor the blood pressure over the next couple of weeks. Go to the health center. If you have a friend who has a monitor, ask them if you can use it for a week, right? Write down your blood pressure every day. And because if you want to tell me it's just because you come to the doctor's office, which can happen sometimes, you have patients, they're a little nervous, they're coming in, their blood pressure may be a little high, but not if it's 200, right? It's not going to be so high. That means it's already high if you're going to reach that level. So I tell them, go write it down and come back and see me in a week with the readings or in 2 weeks with the readings, and we'll talk. So I try to find little ways to make them think about it. I said, do you know somebody who has high blood sugar, somebody who's diabetic? Is anyone in your family diabetic? Do you know some of the things that can happen? I'm sure you know somebody who's lost their leg, and you see that little thing you have there, it's only going to get bigger if the sugar is not controlled. So we have to try and come down to their level, put ourselves in their place, try to encourage them as much as we can. At the end of the day, I cannot come to your home and give you the medication. I try to speak with their family. They come with a family member. We speak to the family member as well so that that person can encourage them. But acceptance of the diagnosis, I find, is an impedance to them actually complying. So that's one of the things we try to provide counseling and encouragement and letting them know that it's not necessarily a death sentence unless you don't take care of it.
Thank you, Doc. Any last words to our public before we close? our program today. Any last words you'd like to leave to our public out there?
Um, I think I've pretty much covered what I wanted to say. In terms of the childhood cancer, so there was a day observed in February, but usually the month is September. So the St. Lucia Cancer Society usually celebrates in September, and the color for that is gold. So I'm
Yes.
wearing my gold today. Both it's a flag color plus it's for childhood cancer awareness. Um, so I just want to encourage us as parents, just look out. Don't ignore the things your children say to you. If you find something is off, then by all means, get that investigated. You don't want to wait, but just remember it's not very common, so don't jump on it. The first time your child tells you they feel a bit unwell, and let's also remember that for us to take care of our children, we need to be healthy. So let's do what we can to take care of ourselves and prevent, cancers and other chronic diseases in ourselves, so that way we can live long, healthy lives and we can see our children grow up and be able to be there for them. So I just want to encourage everyone. That's pretty much. Thank you so much for having me. I'm happy to have been able to help you, help others, shed some light and some information.
Doc, well, I have to say thank you because I feel that you gave quite a bit of information out there, new information that we really needed to hear. Um, I mean, I too learned quite a bit, and I'm hoping that the public out there did learn something new. Um, I think you spoke well and in explaining everything. I am quite happy that we had you. I must admit, although it's the first time I am meeting you, I've never met you before. But when I told a friend of mine that I'm having you on board, she said, "Oh, okay, okay." And then she explained to me who you were and so on. So I'm really, really happy, and I'm hoping that in the near future you could really come to the program. Again, she told me you've been on other programs before. I think Healthwise. Yes,
Yes.
yes, yes, yes. So she told me look out to see you on Healthwise off and on. So I'm hoping that you can join us on other topics on Casualty 911 because that seems to be your thing, and I'm really, really happy that we had you here. And also, I'm hoping that our listeners took heed of everything that you said, and especially our small communities, because I really, really want us to build back our confidence in our doctors, in our wellness centers, our hospitals. I think that is the way forward for us so more people can access the services that we offer at our wellness centers and our hospitals. Again, Doc, thank you so very much. Let me just say a few announcements. Well done to our LAFAC team, LAFAC Wellness Center, who had their walk on Sunday, especially for our diabetics and hypertensive. Um, it was well attended. Thank you to all our supporters who came out, all the groups around the Choiseul and Saltibus area. Thank you so very much for coming out to work with our diabetics and hypertensive group. Lafag Wellness Center, well done. We're hoping that more things will come and more community mobilization. And we're hoping that our community members can make use of our services at our wellness centers, not only in our region, but other regions. So we're hoping that you can come out in your numbers, come to our wellness centers, if anything, and you can always call to find out what services are offered at our wellness centers. Come out, speak to your nurse, speak to your CHA, speak to your attendants. I'm sure they are happy to have you to come to our wellness centers. We know some of you have busy schedules. I know some of the nurses can accommodate persons, especially for persons who wants to come and do their pap smears and they're working, especially our hotel workers. If you want to do your pap smear, do your breast examination, our nurses are happy to assist you on days you are available and it's not a doctor day. I am sure they will assist you. So don't be hesitant and feel that you have a busy schedule and our nurses cannot accommodate you, they will try to accommodate you as much as possible. If they cannot accommodate you at one wellness center, I'm sure they can recommend another nurse to you. All right. To all our listeners, I would like to say thank you so very much for those on Facebook, those listening via social media. Thank you so very much for listening, especially our Sufre community, Choiseul and Canaries, and all the workplaces that are tuned in. And again, thank you so much, Olan, as well as Romanus, for assisting us with our program. So, having said that, I would like to wish everybody a blessed week. And I hope our super communities, our super community can still go on strong, free from violence, free from everything that is not good. And we hope that we can continue working together as a community and as a team. All right. Thank you so very much, Doctor.
Thank you again. It was a pleasure to be with you.
Likewise.
All right.
Health is not merely the absence of Casualty 911, 10 a.m. to 11 a.m. with the consultant. Health is not merely the absence of diseases. It is your social, economic,